Hello and welcome. You're watching Lockdown TV. This is the news and discussion program from UnHerd.com. We have been on quite the run for the past few weeks. We seem to have become the place for discussion of epidemiology. Who would have thought it? We began with a guy called Johan Giesecke, Professor of Epidemiology from Sweden, and that kind of kicked off a whole discussion about lockdown, about this current COVID pandemic, about what the proper response to it is. And the response to us has been extraordinary. We've seen literally millions of people viewing the videos and coming back to us keen to have more intelligent and somewhat skeptical analysis and approach to this huge event. On the other hand, we do not want to be overly skeptical and suddenly become a place that only pursues one side of the argument. So I'm delighted that here to correct us and tell us what we've been getting wrong is Dr. Natalie Dean. Hi, Natalie.
Hi, thanks for having me.
So you are the Assistant Professor of Biostatistics at the University of Florida, is that right?
That's correct, yes. I specialize in infectious diseases, yeah.
Well, we were excited to talk to you, first of all, because you've been doing such an eloquent job on the news networks of, as it were, explaining the pro-lockdown position or explaining why the lockdown has been necessary. You co-authored a piece in the New York Times, which argued that those people pushing for some kind of herd immunity strategy were being irresponsible. So I'd start by just asking you to kind of lay out the land as you see it. Why have these lockdowns been necessary, and why are people wrong to question them?
I don't think people are wrong to question them, right? I mean, it's a huge event, and as you said, it's important to understand exactly what are the decisions that motivated, these big strategies. But what we know is that this is a really fast-spreading disease, and it has very severe outcomes. I mean, what we saw happen in Italy and what we saw happen in Spain and New York City, those should all give us great pause. Very quickly, things can take off to such a sharp degree that if you don't have proactive strategies in place to keep things at a reasonable level, then it quickly gets out of control. And so the lockdowns are really, it's like a hammer. It's a big sledgehammer to, a difficult problem. And it's a crude approach, but it buys us time to build up the other strategies we need. And then, once we have those built up, then we can safely exit lockdowns. We all want to safely exit the lockdowns.
Do you believe that some of these states that are starting to open up already are being irresponsible in doing that, and that you'd like to see a more cautious approach?
What I'm worried about is that states have not put in the other systems that we need to actually feel confident that we're safely exiting lockdown. So some states are being responsible and working toward this. Massachusetts, for example, is hiring, thousands of contact tracers and people who can work from home, make phone calls, and try and break some of these chains of transmission. We're seeing other places that are really building up their testing capacity. But there are some states where they don't seem to have built up that infrastructure and then are stopping the lockdowns, trying to reopen businesses. But there are more cases now circulating than there were when the lockdowns were in place. So things are just going to take off even more quickly because there are more people in the community who are infectious. So the lockdowns buy us time, but they're not a proactive measure to actually bring the numbers down. All they do is slow things, temporarily.
They buy time to do what? What is it that you want to see happen? What's the responsible approach after this?
Lots and lots and lots of testing. I mean, we know testing is not just to, for statistics, it's not just to know kind of how you're doing. Testing is an intervention. I mean, if you go out, people value information, and knowing that someone is infected, you can make good decisions, identify their contacts, and let them know that they should be isolating. I think when you just tell people you should stay home because you have the sniffles, I don't know how seriously people always take that. And so there's a lot of value in having, testing information. So that goes along with the tracing and the isolation. And then also there are initiatives to do more testing of people without symptoms. So some hospitals are screening all inpatients, even if they're being admitted for a surgery that's unrelated to COVID or something like that. Doing more testing of people without symptoms in a routine way who are at high risk, and that will help us drive down the numbers as well.
The idea that in your kind of version, we would keep lockdowns in place, whether it's a state or within a country, until there is a sort of testing and tracking infrastructure that could do this level of monitoring. And then only then you'd release it.
Yeah, so it's not just my plan, right? There are all these published exit strategies, and they all say something roughly consistent. You need to see some sort of stabilization in the number of new cases. You need to be able to effectively treat all of the people. You need, have good enough hospital care at that time. And then you need to be able to do, some level of tracing. Ideally, tracing doesn't easily scale. If you have big numbers, it's hard to track down everyone, but it all contributes to helping drive things down. We don't always need to do everything perfectly, but if we do a number of things all right, that's how we drive things down.
I mean, how many people do you believe have been infected in the United States?
I participated in this expert survey, and we had to estimate what we thought. I mean, I think I put a number under, like around 15 million.
So if you've had 15 million people, how are you going to contact trace or deal with those kinds of numbers? It seems very challenging.
Yeah, so 15 million, importantly, that's the cumulative number of infections. So it doesn't indicate how many are sick right now. And that's who you would need to contact trace. Yes, the numbers are big, but it's a big country. So, I mean, when you start to break it down into smaller units like states and counties, then, as long as everyone's working on the problem together, then that can really help, So there are just a lot of people who are unemployed right now or sitting at home, want to help. And I believe that some of them can be trained to make phone calls and help out here.
So this sort of new world that we're going into with all of this testing and contact tracing, do you foresee a continued period of social distancing as part of that formula until we get a vaccine? Or
I think that there's going to need to be some sort of sustainable changes in our behavior, and people are looking into creative strategies. I, for example, can work from home, and people who can work from home should continue to do so. We can find ways, people are looking into using sort of shifts at workplaces so that people are sort of in like a pod of people that are not interacting with lots of new people. They're looking into doing that types of things at daycares and schools and trying to find ways to reduce the sizes of networks, so still allowing people to have more networks than they have, a bigger network than they have right now, but trying to find ways to reduce the connections between networks to make a broader component.
So, football games, for example?
No, I don't think that's on the table. I don't think in any strategy that's on the table right now.
But until a vaccine, I mean, for the long term, until there's this vaccine moment, do you think we'll be able to have big crowds at football games? Will people be able to go to nightclubs and bars and congregate and mingle?
I want those things too. I want those things too. I don't want to be the bearer of bad news, but who is actually suggesting that those things reopen? No one. I'm not hearing that from Sweden. I'm not hearing that from anyone. So, it's.
Do you think that is the long? I mean, if we're being sort of.
Yes, if we're being honest. Being honest, this is longer than people really think. But I do believe in science, and I believe that there are other creative strategies that we can pursue that will make us better off.
In order to justify making that effort, you need to be confident what the threat is. And that's the sort of other side of the equation, isn't it? That, you wrote a piece, as I mentioned, in the New York Times, and you said, to those people who are arguing for herd immunity, if you believe that if we just let it go and allowed herd immunity to do its work, millions will die. I think that's a quote from the article. How can you be so sure that millions will die?
The numbers specifically for the U.S. that people have modeled, if you kind of let things go, are 500 to 700,000. I mean, so it's millions across the globe. But yeah, I mean, We have evidence from a lot of different places now that that this is a disease that both is severe, particularly in certain groups, but also spreads very quickly. So to understand what can potentially play out, that's mostly driven by what we're seeing at the top of the iceberg, which is that a lot of people, in areas where it's able to take off, we're seeing a lot of deaths and a lot of hospitalizations.
So that 500 to 750,000 figure, what is that based on? How do people get to that?
Yeah, so there have been a number of different models published. It all ends up being quite crude in the end, right? Because you have to make a lot of assumptions, but it's, so that's a ballpark range. But it's based on understanding the population structure and assuming that, it's going to spread throughout the U.S. I mean, it's not going to spread throughout the U.S. right away, but as long as there are pockets that persist where, there are enough people who are susceptible, then it's going to sort of work its way into those pockets, because it looks like this disease is going to be, endemic to some degree.
So you said that you have to assume that it would spread throughout the population. And one of the mysterious things we seem to observe is that it doesn't necessarily, or at least it hasn't. I know, Professor Neil Ferguson's model, which has come under a lot of criticism for the UK, and he did one for the US as well, that came up with a figure of 2.2 million if it was left unmitigated. He was presuming that as much as 80% of the population would become infected quite quickly. And it's just remarkable that that doesn't seem to have happened in any country, and including countries that have had really lax and quite, by your standards, substandard interventions and treatments. So what is your explanation for that?
Yeah, so two big things. One is timing, right? So it depends on how long the epidemic has been allowed to spread in a particular area. We know that it hasn't started at the same time in all different places. Okay, so there's some areas it's been allowed to spread for longer, but we're still very early in the time span of this epidemic. When it's allowed to spread, it will take time to move through a population as heterogeneous as the US, for example. The other thing is we're not seeing unmitigated spread because it's being mitigated. I mean, this is unprecedented in terms of the movement restrictions. I mean, so we're not seeing that what would have happened because it's not normal for everyone to be at home.
Right. But is it not possible? I mean, we don't know where we'll be in a year or in 2 or 5 years' time, but the epidemic simply never really takes root in some areas and some countries and among some populations. And that we saw as a kind of initial flash where there were very close proximity, big epidemics, and a lot of vulnerable people died. And then it might not really take off in other places. I mean, how do you know that it will pass through all of these populations?
There's definitely stochasticity, there's randomness to when something is seeded. And, for example, with Zika, we wondered how much was it going to spread everywhere, and it sort of ended up being most, contained to Latin America for a big amount. So, but it's about those constant reintroductions. So if you allow things to spread, it's that constant threat of a reintroduction, and we know that this can spread quickly. So it's not all going to happen in a few months, right? It can be longer timescales, but that's why there's like waves that happen with epidemics where it starts to it moves through an area, it skips some parts, but then it comes back another time, and because there's enough parts where there wasn't some buildup of immunity, it comes back and hits those other spots.
So your view, the only thing that is slowing down those exponential growth curves in every country, one after the other, is social distancing and improved hygiene and those kind of measures that we know about. There aren't other factors at work.
Well, the improved hygiene is sort of an explanation for why things might slow down before a lockdown, but the real slowdown comes from the lockdown. I mean, there's just biologically, it just makes a lot of sense that if you go from interacting with 60 people a day to 2, that you're going to infect fewer people. I mean, it's just biologically, it just makes a lot of sense that lockdowns do work. I haven't seen a lot of debate around that. So, when we see these dramatic slowdowns, that's the Occam's razor. That's the most logical explanation.
A lot of people in the UK observe that the slowdown actually happened either 1 or 2 weeks before the legal lockdown happened. And as you say, that might be because people were beginning to observe those habits without being legally told to do so. Another example is Sweden that people talk a lot about. In Professor Ferguson's models, Sweden should be the virus should be everywhere by now in Sweden. And we should be seeing tens of thousands of deaths. In his, I think it was the 30th of March update, he said that he calculates the R number in Sweden is still 2.6, maybe as high as 4. And he said in his interview to us that he expects the number to carry on growing. And yet, without a lockdown, they seem to have not only flattened, but reduced that curve. And they're starting to see, the total numbers in hospital come down. How would you explain that when they haven't needed to resort to a lockdown?
So Sweden has had measures in place. They have dramatically changed their behavior, right? They've closed, universities. They have, encouraged work from home where possible. They, have closed events larger than 50 people. So there have been a lot of changes, and people, are also respecting, that they're modifying their behavior, even if they're allowed to go to things. We are seeing, drops in the economy. The people are not going places as much as they were before. So, we expect things to be slower.
Are you surprised how Sweden seems to be faring relatively well despite not having a lockdown? Was that something that took you by surprise?
I'm not convinced that they're doing well. They're doing much worse than their neighbors. And so, and I'm not convinced that it's definitely things have slowed down, but I'm not convinced that it's going down in some, way that's that can be continued into the future. There's a lot of randomness in outbreaks, and so you can have a little part where it looks like it's slowing down. There's also lags in reporting. There are a lot of other reasons why the numbers can be a little hard to interpret. But all it takes is getting into a new little area, a new little pocket, and or a nursing home or some other population, and you can see the numbers pop back up.
But then, what they would say is that, yes, they have had recorded more deaths than their Scandinavian neighbors, but then you compare to a country like Belgium, which is just across the sea from them, a similarly sized population, and a deaths per capita, Sweden has luckily had many, many fewer than that. And in Belgium, it's a full legal lockdown. Absolutely, you can't leave the house without a legal reason. And in fact, the countries that have had the strongest lockdowns in Europe are Belgium, Spain, Italy, and to some extent France, and they are the people who've had the worst death toll. So you look globally, and it's hard to say with confidence that it's lockdowns that have prevented the worst outcome.
Well, that's a very confounded relationship, too, because the countries that have had the most severe lockdowns are also some of the countries where they had the earliest problems. So it really spiked there, and then they had to go in, and they couldn't sort of hem and haw and sort of have a milder version. They had to put in something quite extreme. So it's confounded by timing and how much it was able to sort of take off, because we learned a lot of lessons from other places. So I wouldn't, draw too much from that comparison. And I also, in terms of Sweden's success, do they consider that a success to have that many people dying when, they could have prevented that? That's what I want to understand. Like, do the Swedish people think that that's, very successful to have so many people dying?
Well, I think, that's one way of putting it. I think they believe that to have a kind of society that is okay to live in for the medium or long term, if these measures are going to have to last a while, counts for a lot. And they're also worried about the potential negative effects of lockdown. Have you studied those at all? Are you, in the models that you've been doing, have you looked at potential deaths from, as it were, lockdown, either through deaths of despair or people not getting proper hospital treatment for serious conditions they have. I mean, is that something you've looked at?
No, I haven't individually looked at that. It's incredibly important. And as someone who works in public health and global health, I, am very sensitive to, the challenges with lockdowns, especially in sub-Saharan Africa and places where I'm very concerned about interruption of TB treatment, HIV treatment, routine vaccinations. Yes. I mean, I think the distinction is whether you think that there is an acceptable level of infection in young people. That seems to be, in my mind, the big distinction between these strategies. So I'm not saying that lockdown is the only way to try and bring numbers down, but there needs to be some level of a proactive strategy to try and bring down infection in everyone. Because what concerns me about some of these herd immunity strategies is that it seems to selectively target certain populations, which we would do anyway. We recommend that people who are vulnerable should be being safe anyhow. The question is what you do with everyone else. How do you handle everyone else? And I'm very concerned that allowing a high level of transmission in everyone else is going to just put the vulnerable people at more risk. So, and in terms of being able to restart the economy too, it's the economists that I've talked to have been in broad agreement that the best way to be able to restart the economy is to have low enough transmission in the community that people actually feel safe to re-engage with the economy.
Let me bring you closer to home for a second, which is Florida. You work at the University of Florida. That was kind of an interesting case study as well, wasn't it? Because there were these, a big kind of outrage in the beginning of March when there were lots of students having kind of parties on the beach. It was spring break period. And there was a lot of concern, understandably, because Florida has one of the oldest populations in the United States, that we could see a really severe outbreak there. And although, sadly, it looks like we've seen just under 1,500 deaths in Florida, we haven't seen anything like the situation that we've seen in New York or New Jersey. What's your explanation for that?
Yeah, I think it's a lot, again, timing and luck. And Florida is very different from New York and Jersey just in terms of density, and use of public transit, and there are just different features that put certain populations at greater risk. And there's a benefit to not being on the leading edge of the pandemic. So New York and New Jersey, I think, got very unlucky there. So I mean, my county where I've been has been extremely proactive, and actually closed things down before the rest of the state did. And now they're implementing a testing and tracing. They're making testing available to all inpatients. They're making routine testing available to all healthcare workers. You can get, I think, up to 2 tests a week or something like that, even if you have no symptoms. And so, we're taking a very proactive policy, and I think will pay off in the long run.
But it seems like another problematic data point for that narrative, though, because we now know that there was community spread in the US as early as December. So in a state like Florida, with massive transport hubs in Miami and Orlando, you have people coming in and out throughout December, January, and February, unmitigated completely with no protection measures. And yet we still haven't seen the kind of explosive pandemic that we might have predicted. Why hasn't it happened? And do you think it just means, when you answer timing, is it just that it's going to happen later and it's inevitable, or is there a scenario in which it never happens, and actually, due to climate, due to the nature of the place and whatever else, COVID-19 just doesn't really take root in Florida in the same way?
There are a lot of complicated factors. You touched on a few, like we don't know the role of temperature, for example. I haven't seen any great evidence that temperature plays a big role, but it's all very possible. So we don't know exactly what some of the other features might be. I mentioned population density, although Miami is very dense as well, and that's where they've had the most cases, is down in Miami. So but I don't think we're ever going to see just unmitigated in the future. There's always going to be some level of response, but as things lift up, I do expect to see more transmission, especially in areas where they're not taking a proactive approach. We're still very early on in this pandemic, so I would expect more transmission.
So I guess what it comes down to really is an unknown period of time with enormous, and I think we can't minimize them. We may laugh about life without football games, but, grandparents seeing their grandchildren, family get-togethers, weddings, funerals, planning events, the whole kind of fundamental part of human society being in some way curtailed is not an acceptable option to a whole bunch of people. And I think, that it doesn't mean that they are cavalier about human life, or, they just don't feel that's like a reasonable future to be voluntarily walking into. Do you have any sympathy with that?
Absolutely. I'm a person. I want my kids to see their grandparents. It's very challenging and upsetting. And I feel bad for all the people who've had to cancel their weddings. And I mean, it's devastating. But at the end of the day, if you want to be able to see those grandparents, then they need to be protected. And so what I'm very concerned about is people getting infected and then infecting their loved ones, unintentionally. But that's the reality of that. Our society is not neatly divided into high and low risk, right? We all mix together. And so by having a lot of transmission among people who are low risk, we're putting people at high risk. So, I want those things to happen too. And I really feel like the best way for that to happen is to try and drive the numbers low. And I feel like the countries that are going to be able to, where they're going to be able to see their grandparents, are countries like New Zealand and South Korea and Vietnam and, these other places that have had early success. So I don't think that the Swedish model will get them closer to seeing their grandparents than, in the countries that have done a good job driving the numbers low.
So what happens in countries like New Zealand with foreigners and visitors? I mean, if your grandparent is in a different country and you're in New Zealand, it sounds like it's going to be tricky because they've shut the airports and they're not letting anybody in because they have no infection at this point.
So that's why we really need to support other countries, because a threat, anywhere is a threat everywhere. And if there's still a raging epidemic in some other part of the world, then we're all going to be at some heightened risk. And, so I think the strategies that people would probably pursue would be some level of what they're already doing now. Like if someone comes into the country, they need to be in isolation for some period of time.
So it almost seems like what we're going towards is internationally some states opting for this kind of super proactive suppression policy like we've seen in New Zealand. They are then going to be by necessity quite closed off to other countries and hard to get in and out of. And then you have countries like Sweden, and it looks like the same thing might be happening in the US. There are basically red states who are now pushing much faster to reopen and are not interested in trying to kind of keep the virus completely suppressed. And then what looks like blue states, basically, who are opting for this much more severe shutdown policy. We could see a kind of divided US between states that have no virus and states where they've kind of accepted that the virus will be endemic.
Yeah, I think probably what's going to happen, to some of these states that open up prematurely, if they have a lot of transmission, they're going to need to revert back to more stringent measures. And that's probably what's going to happen. And it's, it's like the grasshopper and the ant. I think there's a lot of value to starting the hard work now, and it'll pay off more in the long run.
Are you worried about the politics of this? I mean, I got a lot of messages from Democrat friends in New York City and on the West Coast saying, why are you interviewing these people? They are, being skeptical about the danger of the disease. It's dangerous. There are people protesting in state capitals and it's irresponsible. And it feels like it's become such a political issue. Do you observe that? Do you observe differences between basically Republicans and Democrats on this issue?
I can see it bubbling up, and it makes me nervous because I only want to present myself as a scientist and try and, go with the best science-based approach. And I really don't want this to get drawn into all of the politics. But if it happens, then the most I can do is try and share what I think is the most reliable information and hope people listen.
We have such a divide between people who see things very clearly in one direction, and they frankly think that people who see things differently are bad or irresponsible because they're dicing with death in some way. And then the opposite side that feels like their whole lives have been upturned for an uncertain projection that in many cases hasn't actually happened. And they don't feel that that's a trade that they get behind. How can we bring these things together?
It's hard. I sympathize that it is an enormously disruptive situation and it has affected people in a huge way. But that's the pandemic. That's, a lot of that is the pandemic. I mean, I wouldn't attribute that wholly to the lockdowns. I mean, the economy is going to tank because of the pandemic, not necessarily just because of the lockdowns. But what I see is something that, spread very quickly, overwhelmed healthcare systems when it wasn't being contained, and that puts people at very serious risk. So that's why, there's pretty broad agreement among most epidemiologists that you need strong measures to deal with this. This is a very significant situation. So,
Dr. Dean, thank you so much for sharing your thoughts. Okay, thank you.
Bye. Take care.
You've been watching Lockdown TV. That was Dr. Natalie Dean joining us from Florida. She was pushing back on some of the arguments we've heard from some of the experts we have interviewed here at UnHerd over the past weeks. As always, we leave you to decide, but thanks for joining us.